Hello everybody, my name is Omar and today we're going to be explaining the female menstrual cycle. Female menstrual cycle is a hormonally regulated series of changes in the uterus, primarily the endometrium, designed to prepare for and support potential pregnancy with distinct phases for shedding, proliferation, and secretion. It is important because understanding the menstrual cycle is foundational for diagnosing and managing female reproductive health issues such as infertility, hormonal disorders, and is critical for medical, dental, and pharmaceutical professionals. A common mistake is that frequent misconception is viewing the menstrual cycle solely as the uterine bleeding rather than a complex interplay of hormones and tissue changes crucial for fertility and overall female health. Purpose of this summary is to provide an immediate digestible overview for rapid comprehension and initial context. A topic overview, this summary will guide you through the intricate phases of the female menstrual cycle, detailing the remarkable transformation that occur within the uterine lining, endometrium, and the precise hormonal control that orchestrates these changes. You will learn about the distinct shedding, proliferative, and secretory phases and the crucial roles of estrogen and progesterone. This knowledge is essential for healthcare students to grasp female physiology, understand reproductive health, interpret menstrual irregularities, and comprehend the mechanisms of various hormonal therapies and contraceptives. Key definitions and concepts. Menstrual cycle is a recurring cycle of physiological changes in females primarily regulated by hormones to prepare the uterus for potential pregnancy. Endometrium is the inner lining of the uterus which undergoes cyclic changes in response to hormones. Now, stratum functionalis is the superficial layer of the endometrium. So endometrium is divided into two layers, stratum functionalis and basalis. Stratum functionalis is the first superficial layer that proliferates. It is the one that sheds basically and is shed during menstruation. It contains spiral and coiled arteries, emphasis on spiral and coiled, while stratum basalis is a deeper permanent layer of endometrium that remains after menstruation. It regenerates the stratum functionalis. It contains straight arteries. Menstruation is the shedding phase, which happens from days 1 to 5, where stratum functionalis is shed from the uterus and accompanied by bleeding. The proliferative phase is the phase where it happens from days 6 to 14 of the menstrual cycle, where estrogen stimulates the regeneration and growth of the stratum functionalis. Secretory phase is the phase days 15 to 28, where progesterone primarily drives further thickening and nutrient excretion by the uterine glands, preparing the uterus for implantation. Estrogen is a primary female sex hormone responsible for regenerating the stratum functionalis and promoting angiogenesis. The angiogenesis means synthesizing new arteries, basically the coiled and spiral, and influencing cervical mucus. Progesterone is a primary female sex hormone produced by the corpus luteum, which is the follicle after ovulation, responsible for further thickening of the endometrium, stimulating glandular secretions, and influencing cervical mucus to become thick. Spiral and coiled arteries are blood vessels found in the stratum functionalis that are crucial for its blood supply and rupture during menstruation. Straight arteries are blood vessels found in the stratum basalis. Cervical mucus, which is thin, produced during the proliferative phase, aiding sperm movement. Cervical mucus plug thick due to progesterone, produced during the secretory phase, blocking the cervix to protect potential embryo. Corpus luteum is a temporary endocrine structure in the ovary formed from the remnants of the ovulated follicle, primarily producing progesterone. Human chorionic gonadotropin (HCG) is a hormone produced by implanting the embryo that signals the corpus luteum to continue producing progesterone, maintaining pregnancy. Also, human chorionic gonadotropin (HCG) is like a growth hormone. It even influences the pregnant female. Corpus albicans is a scar tissue formed from the regeneration of the corpus luteum if pregnancy does not occur. Necrosis is cell death, while ischemia is the lack of oxygen and blood supply to tissues. So ischemia leads to necrosis. When there's lack of oxygen, there will be cell death. A key question is that you must describe the differences in the endometrial layers and their vascular supply during the menstrual cycle. Now, after explaining, I will show you an image to help understand. Menstruation, in which it happens from days 1 to 5. The cycle begins with the shedding of the stratum functionalis, the superficial layer, along with blood. This shedding occurs due to the breakdown and rupture of spiral and coiled arteries within the layer which were previously supporting it. As you can see, menstrual phase, the basal layer, which does not shed, but the functional or superficial layer, functionalis, will shed. And days 1 to 5, there's a lot of bleeding. Proliferative phase, days 6 to 14, this phase is driven primarily by rising estrogen levels. So this is very important. I cannot emphasize enough. Estrogen is the one that controls the proliferative phase, while the secretory phase is controlled by progesterone, produced by the developing ovarian follicles. Estrogen, as we said, the the granulosa cells, theca cells, all of these will help in producing estrogen. Estrogen stimulates the regeneration and rapid growth of the stratum functionalis from the underlying stratum basalis. New spiral and coiled arteries also grow and uterine glands begin to develop, though not yet secreting. Cervical glands produce thin, watery cervical mucus which facilitates sperm transport and capacitation or activation. Secretory phase, days 15 to 28, is phase dominated by progesterone produced by the corpus luteum, formed after ovulation. Progesterone causes the stratum functionalis to further thicken and become more glandular. Uterine glands become highly active, secreting a nutrient-rich fluid, contains lipids, glycogen, proteins into the uterine lumen. This is really important to focus on, the uterine glands that are secreting nutrient-rich fluid, because this nutrient-rich fluid is going to be the source or the food basically for that embryo that's going to be implanted. It's like its own storage or supply of food, creating an ideal environment for potential embryo. Cervical glands produce a thick, sticky cervical mucus plug that blocks the cervix, preventing further sperm entry and protecting the potential embryo from pathogens. What happens if fertilization doesn't occur? No fertilization, meaning no HCG, human chorionic gonadotropin. If the egg is not fertilized and no embryo implants in the uterus, there is no production of human chorionic gonadotropin by an embryo. Corpus luteum degenerates to become corpus albicans. Without the HCG, the corpus luteum will degenerate around day 24, 26 of a 28-day cycle. Progesterone drops. The degeneration of the corpus luteum leads to a sharp drop in progesterone levels, since corpus luteum is responsible for secretion of progesterone as well. Artery spasm and rupture. The sudden decrease in progesterone causes the spiral and coiled arteries in the stratum functionalis to spasm repeatedly, leading to a lack of oxygen and eventual rupture. Tissue ischemia and necrosis. The ruptured arteries cut off blood supply to the stratum functionalis, causing its cells to become ischemic and then necrotic, die. Shedding and menstruation. The dead endometrial tissue, along with the blood from the ruptured vessel, is then shed from the uterus, marking the beginning of a new menstrual cycle. So, corpus albicans forms a degeneration of the corpus luteum, eventually transforms it into non-functional fibers called the corpus albicans. Now, let me demonstrate on this diagram. As we said, that the menstrual cycle begins with the menstrual flow phase, which happens from days 1 to 5, where there's a lot of bleeding due to the regeneration of the stratum functionalis. Then there's the proliferative phase, which is controlled by high levels of estrogens. As you can see, this estrogen is secreted from the follicular phase, meaning it's secreted from the follicle, the Gravian follicle particularly, till day 14, where the estrogen would do a positive feedback to lead to high surge of LH. As you can see, the FSH is not as high. So it's basically, estrogen is basically controlling LH surges or positive feedbacks. Then you can see there's the luteal phase, where there is the corpus luteum formation is responsible for secretion of progesterone. This progesterone will lead to a secretory phase from day 14 till almost the end of the cycle, 26, 27, day 26, day 27, where we'd have thickening of the stratum functionalis, engorgement of blood vessels, and other more secretion of by the uterine gland. If fertilization occurs, if an embryo successfully implants, it produces the human chorionic gonadotropin, which acts as a signal to the corpus luteum to continue producing progesterone. This sustained progesterone level maintains thick vascular stratum functionalis, preventing its shedding and supporting the early pregnancy until the placenta takes over hormone production around the 12th week of gestation. Now, a very important question you must ask yourself: which step in the menstrual cycle is most responsible for preparing uterus for implantation? Meaning that after fertilization, it must implant on the endometrium. Now, this is the luteal phase, and the hormone that would drive this is going to be the progesterone. Why? Because as you can see, during the luteal phase, where high levels of progesterone lead to a more thickened stratum functionalis, there is more secretion of nutrients by the uterine glands. This allows the embryo to have sufficient nutrients so it can continue its development. Now, key takeaways and professional relevance. Why this is important in your daily work that you will encounter later on. The menstrual cycle is a fundamental physiological process in females, directly impacting fertility, hormonal balance, and overall health. Its cyclic nature ensures periodic preparation for reproduction. In medicine, it's essential for diagnosing and treating a wide range of conditions such as amenorrhea, dysmenorrhea, which means the absence of the menstrual cycle, or a menstrual cycle that is not that like comes and goes or is not steady, premenstrual syndrome, PMS, infertility, and managing contraception or hormone replacement therapy. Pharmacists rely on this knowledge to provide accurate information and counseling on hormonal contraceptives, fertility drugs, and other medications affecting the reproductive system, including their mechanism of action, side effects, and proper use. While not directly treating reproductive issues, understanding the hormonal fluctuations for dentists during the menstrual cycle, increased estrogen and progesterone can provide insights to patients' susceptibility to certain oral conditions such as pregnancy, gingivitis, or consideration for medication prescription. Now, key points to focus on the exam are the specific events and hormonal drivers of each phase: menstruation, proliferative, secretory, the roles of estrogen and progesterone. This is super important. The changes in the cervical mucus and the fate of the endometrium and corpus luteum, and the critical role of human chorionic gonadotropin in early pregnancy. Another checkpoint question: how does the menstrual cycle contribute to both the possibility of the pregnancy and, if pregnancy does occur, the cyclic shedding of the uterine lining?